Hello everyone, welcome to Logic Medico. Today's interesting topic is submandibular ganglia. So the submandibular ganglia is present beneath the mandible. It is controlled by superior salivary nucleus present at the level of pons, which passes through the facial nerve, joins the lingual nerve to reach the destination submandibular ganglia. Ultimately, it supplies the submandibular salivary gland and also it goes to supply the sublingual gland. This is a summary of submandibular ganglia. But if you want to understand slowly and steadily, I will tell you in detail about this ganglia. So ganglion is collection of neuronal cell bodies outside the CNS. So these are the ganglions. These are the neuronal cell bodies. For convenience, I will just put one dot. Collection of neuronal cell bodies deep within the CNS is called as a nucleus. Now here in the brainstem we have the midbrain, pons, medulla oblongata. Controlling the salivary glands, there were two nucleus, one at a higher level, one at a lower level. So one which is higher is called superior salivary nucleus, the one at the lower level is called inferior salivary nucleus. These nuclei control the ganglions, but they cannot travel by themselves, so they take the help of cranial nerves. The superior salivary nucleus takes the help of 7th cranial nerve fiber to reach its destination, whereas the inferior salivary nucleus takes the help of 9th cranial nerve to reach its destination, that is otic ganglion. 7th cranial nerve controls submandibular ganglion. We'll see that now. So this is the 7th cranial nerve fiber, superior salivary nerve fiber reaching submandibular ganglion. Ultimately, the postganglionic fibers, the axons beginning from here, reaches the destination submandibular salivary gland. Few fibers will also travel across the lingual nerve to reach the sublingual salivary glands, whereas the inferior salivary nucleus of the 9th cranial nerve will travel and reach its destination, that is the otic ganglion. Postganglionic fibers from the otic ganglion passes via auriculotemporal nerve to supply the parotid salivary gland. 9th cranial nerve of the glossopharyngeal nerve controls otic ganglion, which controls parotid salivary gland. Superior salivary nucleus of facial nerve controls submandibular ganglion, produces secretion of submandibular and sublingual salivary glands. So to understand the details of the submandibular ganglion, it is better to know the three routes. So each ganglion will have three routes which passes through it. That is the parasympathetic route, which is represented in blue color here. Sorry, a sympathetic route, which is represented in green color, and the sensory route, which is represented in this pink color. So parasympathetic, sympathetic, and sensory route. Please understand that only the parasympathetic route is a secretomotor fiber beginning from salivary nucleus, which can control the ganglion, whereas the other two routes will just pass through the ganglion without having any control over the ganglion. For example, you are the ganglion, you are the owner of your house, so you are destined to be controlled by your parents. But your friends will come to your home, but the home doesn't belong to them, it belongs to you. They just pass through that, and your parents cannot control them like they control you. So this is an analog I can tell you. So if I want to explain in detail, the parasympathetic ganglion, that is a submandibular ganglion, has got three routes. What are they? The parasympathetic route, which begins from 7th cranial nerve present at the level of pons. So the superior salivary nucleus fiber takes the help of facial nerve. Then facial nerve wants to go to the face, it gives one branch, caudate tympanic branch, which takes the help of lingual nerve, ultimately reaches the submandibular salivary gland ganglion. Postganglionic fiber reaches the submandibular salivary gland. Few fibers will go and supply the sublingual gland. So this route is extremely important. It's called the parasympathetic route. Coming to the sympathetic route, the sympathetic route is this green color route. It will just pass through this. You can see this. It will just pass through this. So what does the sympathetic route do? And where does it start from? It starts from the lateral gray horn of T1 segment of the spinal cord. That is a preganglionic fiber. Then it relays in the superior cervical sympathetic ganglion, that is in the head and neck. The postganglionic fibers form a plexus around the blood vessel, which is closely passing here. That is a facial artery. They just travel through the ganglion without having any control over the ganglion. Ultimately, they control the blood vessel, right? So it's a vasomotor fibers. So they don't rely in submandibular ganglion. That is about the sympathetic root. Last but not the least, sensory root. There is one nerve which is helping in carrying this parasympathetic fiber. It's called the lingual nerve. Few fibers will just pass through the ganglion without any relay like this. That is called the sensory root. So this is the parasympathetic root beginning from superior salivary nucleus, having control over the ganglion. Postganglionic fibers will cause watery fluid secretion from the submandibular salivary gland. Sympathetic root beginning from superior cervical sympathetic ganglion have no control over the ganglion because they don't relay here. Sensory root from lingual nerve, branch of trigeminal nerve, also does not have any control over the ganglion. So these are the three roots. In examination, you are required to write about the three roots. Coming to the actual topic, submandibular ganglion. Whenever the question is asked, you will first comment on the three roots, the gist of it. Then you will tell in the form of a flowchart how we'll come to that, how this nucleus, superior salivary nucleus, controls submandibular ganglion in the form of a flowchart. Before the flowchart, I want you to write simple diagram like this and then write the flowchart. The superior salivary nucleus fibers, that is the preganglionic fibers of the seventh cranial nerve or facial nerve, passes with the facial nerve. This yellow color is the facial nerve. Then the facial nerve has to go to the face, right, by dividing into 5 branches: temporal, zygomatic, buccal, marginal mandibular, cervical. So facial nerve is gone. So here in the infratemporal fossa it gave a branch. This branch name is called as chorda tympani branch. So this chorda tympani branch joins the posterior surface of lingual nerve. So now it takes the help of lingual nerve. So these fibers, the preganglionic fibers of superior salivary nucleus, now taking the help of lingual nerve to reach its destination, that is submandibular ganglion. There is a relay of information. You can see the axons are ending here, and a new set of neurons beginning from here, their axons will travel. This is the postganglionic fibers from submandibular ganglion, passes directly to the submandibular salivary gland, causing watery secretion from this gland. Few of the postganglionic fibers takes the help of lingual nerve again to pass forward and supply this gland which is underneath the tongue, called as sublingual salivary gland. So this is the simple diagram. You just have to label it. In the form of flowchart, you can present it like this. So I will summarize the topic today. Superior salivary nucleus of the seventh cranial nerve present in pons passes through the nervus intermedius branch of the facial nerve. Once the facial nerve emerges out of the cranial cavity, the chorda tympani branch is given out at the level of tympanic membrane, therefore the name chorda tympani. Afterwards, it joins the posterior surface of lingual nerve. Just put my arrow down, so it's flowchart. After that, it finally relays in the submandibular ganglion. The postganglionic fibers from the submandibular ganglion directly supplies the submandibular salivary gland, but few fibers take the help of lingual nerve again to reach the sublingual salivary gland. So the submandibular ganglion not only supplies the submandibular salivary gland, it also supplies the sublingual salivary gland. If they ask nerve supply of sublingual salivary gland or the nerve supply of submandibular salivary gland, whatever I have depicted now in the form of flowchart and this diagram is suffice. If they ask the ganglion, kindly mention about the three roots of the ganglion: the parasympathetic, sympathetic and sensory. Parasympathetic is the one which actually controls the ganglion. Sympathetic and sensory just pass through the ganglion without having any control over the ganglion. Write the definition of the ganglion: group of cell bodies of the neuron outside the CNS. That is the definition. So this is how you should be able to present. Thank you for watching and learning from Logic Medico. Hope this helps you. Kindly share with your friends too. Thank you once again. Bye. Kindly subscribe to our channel if you are not done and press the thumbs up icon.